Do you imagine that every 90 seconds, a woman somewhere in the world is diagnosed with TNBC, triple negative breast cancer, and every 30 seconds, a woman is diagnosed with breast cancer worldwide? This alarming statistic highlights the prevalence of breast cancer and TNBC. But TNBC, which is an aggressive form of cancer, is often overlooked and underfunded. It's time to change that. It's terrifying how little we know about this disease and how widely spread it is. This topic affects many women and threatens their lives worldwide. We will explore what TNBC is and how it differs from other types of breast cancer, and the early signs every girl should watch out for, and how to check yourself at home for any type of breast cancer signs. Also, we will discuss the statistics and survival rates, causes, and the last innovative treatments for both diseases. So, let's get started. What is TNBC? How does it compare to other types of breast cancer? Let's break it down. Breast cancer isn't one size fits all. There are several types, nearly 11, and understanding these differences is crucial for treatment planning. We will know first about TNBC, triple negative breast cancer. It is a subtype of breast cancer that lacks three key receptors: estrogen, progesterone, and HER2, which stands for the human epidermal growth factor receptor 2. It is a protein that plays a critical role in the growth and division of cells, particularly in breast tissue cancer. This means that TNBC doesn't respond to hormonal therapies or targeted treatments that are effective for other breast cancer types. TNBC requires chemotherapy as its main treatment option. The second type of breast cancer is called invasive ductal carcinoma, IDC. It is the most common type, starting in the milk ductus and spreading to surrounding breast tissue. The third type is invasive lobular carcinoma, ILC. It is the second most common type, originating in the lobules that stand for the milk-producing glands and can spread to nearby tissue. 4. Ductal carcinoma in situ, DCIS, a non-invasive condition where abnormal cells are found in the lining of the ductus but haven't spread to surrounding tissue, often considered a precursor to invasive cancer. 5. Lobular carcinoma in situ, LCIS. It isn't considered a cancer, but indicates an increased risk of developing breast cancer in the future. 6. HER2 positive breast cancer, characterized by overexpression of the HER2 protein, which promotes the growth of cancer cells. This type can be treated with targeted therapies like trastuzumab, Herceptin. 7. Inflammatory breast cancer, IBC. It is a rare and aggressive form that causes the breast to become red, swollen, and warm, often without a distinct lump. It requires immediate treatment. 8. Baggett's disease of the nipple. It is a rare form that involves the nipple and areola, often associated with the underlying breast cancer. Symptoms include scaly, red, or itchy skin on the nipple. 9. Metaplastic carcinoma. It is a rare type that contains a mix of different cell types, including carcinoma and sarcoma. Treatment may vary based on its characteristics. 10. Phallodest tumors. It is a rare tumor that can be benign or malignant, arising from the connective tissue of the breast. They tend to grow quickly but rarely spread outside the breast. 11. The male breast cancer. It's so rare but men can develop breast cancer, typically presenting as invasive ductal carcinoma. Those are the 11 types of breast cancer. But did you know that TNBC, the triple negative breast cancer, isn't just one type? It's actually a collection of different subtypes, each with its own unique characteristics. This heterogeneity means that some TNBC tumors can behave differently than others. Understanding these subtypes can help doctors tailor treatment plans that are more effective for each individual. So, if you or your loved ones is diagnosed with TNBC, remember that there is a spectrum of possibilities and ongoing research is paving the way for more personalized treatments. TNBC accounts for about 10 to 20% of all breast cancer. It's more common in younger women, particularly those under 40. We will analyze the statistics and survival rates later in the video, so stick with me for a little bit. This is the most important section in this video. What you should look out for. Here are some early signs of breast cancer that every girl should be aware of. Number 1. Lumps or masses. Like TNBC, the presence of a lump is often the first noticeable symptom. 2. The changes in size or shape. Alterations in the size or shape of the breast may be observed. 3. The skin changes, like the dimpling or puckering. Similar to TNBC, other breast cancers can cause skin dimpling. Nipple changes, discharge, inversion, or changes in texture can occur. The breast or nipple pain is a common symptom across all breast cancer types. 6. The swollen lymph nodes. Swelling in lymph nodes may indicate the spread of cancer. Now, let's talk about how to perform a breast self-exam. It's a simple yet effective way to stay on top of your breast health. Step 1. Start by looking in the mirror. Check for any changes in size, shape, or skin texture. Step 2. Raise your arms above your head and look for any changes in your breasts. Step 3. Lie down and use your fingers to feel for lumps. Use a circular motion covering the entire breast area. Step 4. Don't forget to check your underarms. Step 5. Repeat this process once a month, and don't forget to schedule your annual checkup with your healthcare provider. A little awareness. While many breast cancers, including TNBC, may not present symptoms until they have progressed, regular screenings, such as mammograms, are crucial for early detection. Awareness of these symptoms can lead to timely medical consultations, which are vital for effective treatment and improved outcomes. If you notice any of these symptoms, especially if you have risk factors of breast cancer, it's important to consult a healthcare professional for further evaluation. Remember, early detection increases the chances of successful treatment. Now, how can you differentiate TNBC from other types of breast cancer? The key lies in diagnostic testing. When a breast tumor is suspected, pathologists perform tests to check for the presence of estrogen, progesterone, and HER2 receptors. If all three are negative, it's classified as TNBC. The genetic factors also play a role. Women with BRCA1 or BRCA2 mutations, that stands for important genes that play a crucial role in the body's ability to repair damaged DNA. When you have their mutation, you will be at higher risk for developing TNBC, so genetic testing can be an important step. You need to know statistics and survival rates of TNBC and breast cancer disease. To understand, it is closer than you think, and any woman at any age can get it, so you have to protect yourself and pay attention to signs. First, this is the chart that explains the estimated incidence rates of TNBC versus breast cancer. TNBC accounts for approximately from 10 to 15% of all breast cancer cases. This translates to about 345,000 cases of TNBC diagnosed globally each year, based on the total breast cancer cases. The second chart explains the global diagnosis of TNBC by age group. It shows that women under 40 years old have the highest odds of being diagnosed with TNBC. Research indicates that this age group has an odds ratio of 1.95, meaning they are nearly twice as likely to be diagnosed with TNBC compared to women aged 50 to 64. The third chart explains the survival rates of TNBC versus breast cancer. TNBC, the triple-negative breast cancer, have overall 5-year survival rate about 77% for all stages combined. The 5-year survival rate is about 91% for localized stage, 66% for regional stage, and only 12% for distant stage. Recurrence rates are high, with about 40% of individuals with stages 1 to 3 TNBC experiencing a recurrence after standard treatment. The median survival time after metastasis is only 13.3 months. The other types of breast cancer, the overall 5-year survival rates are generally higher, often exceeding 90% for localized cases. The hormone receptor-positive breast cancers typically have survival rates of 90% or higher for localized stages. So, what are the key differences we can get from these rates? The key differences: Number 1. TNBC is more aggressive and has a higher likelihood of recurrence compared to hormone receptor-positive breast cancers. Number 2. Lacks targeted therapies, making chemotherapy the primary treatment, while other breast cancer types can benefit from hormonal and targeted therapies. Number 3. The overall prognosis for TNBC is generally poorer, especially in advanced stages, compared to other breast cancer subtypes. Understanding the factors that influence survival rates can be empowering. The 5-year overall survival rate can vary based on several factors, including age, tumor grade, and whether the cancer has spread to lymph nodes. Knowing these indicators can help you and your healthcare team make informed decisions about treatment and follow-up cares. Remember, every case is unique, and advancements in research are continuously improving outcomes for patients. This fourth chart explains the demographic distribution of breast cancer and TNBC. The incidence: in 2020, nearly 2.3 million cases of breast cancer were diagnosed globally. The distribution of these cases varies significantly by region. For example, Eastern Asia, nearly 25% of all cases. Northern America, nearly 12.5% of cases. South Central Asia, nearly 11.3%. Western Europe, nearly 7.5%. The mortality: about 685,000 deaths were attributed to breast cancer in 2020, with high mortality rates observed in Eastern Asia, South Central Asia, and Southeastern Asia, combined accounting for nearly half of all global breast cancer deaths. North America have 7.1% of deaths. Western Europe have 6.4% of deaths. Now let's move to the next section. It is about the causes of TNBC and breast cancer. We will discuss now what causes triple-negative breast cancer, TNBC, and breast cancers. The causes of TNBC and breast cancer are complex, with a combination of genetic, hormonal, and lifestyle factors playing a role. While we can't control all the risk factors, understanding the potential causes can help us take proactive steps to reduce our risk and catch any issues early. The first cause is the genetic factors. Certain gene mutations, especially in the BRCA1 gene, are strongly associated with TNBC. If you have an inherited BRCA1 mutation, you have a 70% chance of developing TNBC. Other gene mutations like BRCA2, TB53, CDH1, BTEN, and STK11 can also increase breast cancer risk. The genetic testing can help assess your risk and guide screening and prevention strategies. The second cause is hormonal factors. Hormones play a complex role in breast cancer development. Factors like early menstrual periods, late menopause, and never having children can expose you to more estrogen over your lifetime. The hormone replacement therapy and some birth control methods may also slightly increase the risk. The third cause is the lifestyle factors. While we can't control our genes or hormones, there are some lifestyle changes that may influence breast cancer risk. A. Being overweight or obese, especially after menopause. The lack of physical activity, drinking alcohol, exposure to radiation. The fourth cause is racial disparities. The African American and Hispanic women have higher rates of TNBC compared to white women. In the US, TNBC accounts for about 21% of breast cancers in Americans versus 10 to 12% in white. Socioeconomic factors and access to care likely contribute to these disparities. The fifth cause is age. TNBC is more common in younger women, with an incidence of 4.2% in those under 40. The risk of all breast cancers increases with age, with over 80% of cases occurring in women over 50. While the exact causes are still being researched, we know that TNBC and breast cancer are complex diseases influenced by a mix of genetics, hormonal, and lifestyle factors. So, staying informed, getting regular screening, and making healthy choices can help reduce risk and catch any issue early. If you have concerns about your risk, talk to your doctor about screening and prevention strategies tailored to your unique situation. Now let's talk about the available treatment option for TNBC. Unlike other breast cancers, TNBC has limited treatment choices. We will discuss them all. The first treatment option is surgery. There are 3 types of surgery. Number 1, lumpectomy. It is the removal of the tumor and a small margin of surrounding tissue. Number 2, mastectomy. It is a complete removal of one or both breasts. Surgical options depend on the tumor's size, location, and stage. Number 3, lymph node removal. Sentinel lymph node biopsy or axillary lymph node dissection may be performed to check for cancer spread. The second treatment option is chemotherapy. It has 2 types. Number 1, neoadjuvant chemotherapy. It is administered before surgery to shrink tumors. Its common regimens include anthracyclines. 2, adjuvant chemotherapy. It's given after surgery to eliminate remaining cancer cells and reduce recurrence risk. The third treatment option is radiation therapy. It has 2 cases. Number 1, it's recommended after lumpectomy to destroy any remaining cancer cell in the breast or surrounding tissue. 2, radiation may also be used post-mastectomy in certain cases, especially if lymph nodes are involved. The fourth treatment option is targeted therapy. Currently, TNBC lacks specific targeted therapy like those available for hormone receptor positive or HER2 positive breast cancer. However, ongoing research is exploring options such as BARB inhibitors. The fifth treatment option is clinical trials. Numerous clinical trials are ongoing to evaluate new drugs and combinations, including novel immunotherapies and targeted therapies based on tumor genetics. Now we will discuss the breast cancer treatment option. It is the same as TNBC but plus other targeted options like the hormonal therapies for hormone receptor positive cancer, drugs like tamoxifen and aromatase inhibitors, and letrozole, letrozole are standard to the targeted therapies. Example, for the HER2 positive breast cancer, we will use trastuzumab, Herceptin, and pertuzumab are effective in treating HER2 positive breast cancer. In this type of breast cancer, the hormonal therapies are the cornerstone of treatment. Both TNBC and other types of breast cancer have a range of treatment options, but TNBC presents unique challenges due to its aggressive nature and lack of targeted therapies. Ongoing research and clinical trials are essential to improve outcome for patients with TNBC and to continue advancing the treatment landscape for all breast cancer types. Do you know that what you eat and your lifestyle can speed or worsen your treatment journey? I know that facing a diagnosis of TNBC or breast cancer can feel overwhelming, but making those positive lifestyle changes can empower you in your journey to recovery. Here are some natural adjustments that can incorporate into your daily routine to support your health, mental status, and well-being. The first thing to do is to nourish your body with a balanced diet. Think of food as your ally. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can provide your body with the nutrition it needs to heal and thrive. Aim to fill your plate with colorful foods. Each color represents different vitamins and antioxidants that can help fight cancer. For example, leafy greens, berries, and legumes are fantastic choices. And don't forget to stay hydrated. Water is essential for overall health. 2. Stay active with regular exercise. Exercise doesn't have to mean hitting the gym hard. It can be as simple as a daily walk or gentle yoga. Engaging in regular physical activity can improve your mood, boost your energy level, and even enhance your immune function. Aim for at least 150 minutes of moderate exercise each week. Whether it's dancing, swimming, or gardening, find activities you enjoy and make them a part of your routine. 3. Manage stress through mindfulness. Stress can take a toll on your body and mind, especially during treatment. Incorporating mindfulness practices such as meditation, deep breathing, exercises, or yoga can help reduce anxiety and promote relaxation. Even just a few minutes of focused breathing each day can make a significant difference in how you feel. Consider setting aside time each day to unwind and reconnect with yourself. You can also manage your stress more by taking those extra steps. The physical activity, engage in regular exercise to boost mood, creative expression, explore art, writing, or music for emotional release. 3. Social support. Connect with friends and support groups. 4. Relaxation techniques. Use aromatherapy or massage for self-care. 5. Mind-body practices. Try yoga or Tai Chi balance and relaxation. 6. Cognitive behavioral strategies like challenge negative thoughts. 7. Spiritual exploration. Engage in prayer or meditation for comfort. The 4th lifestyle change is to prioritize sleep and rest. Why? Just never underestimate the power of a good night's sleep. Quality rest is crucial for healing and recovery. Aim for 7 to 9 hours of sleep each night and establish a calming bedtime routine to help you wind down. If you are struggling to sleep, try reading, listening to soothing music, or practicing relaxation techniques before bed. 5. Connect with others. Building a support network is vital. Reach out to friends, family, or support groups to share your feelings and experiences. Connecting with others who understand what you are going through can provide emotional comfort and practical advice. Whether it's a phone call, coffee date, or joining a local support group, these connections can help you feel less isolated. 6. Limit alcohol and tobacco. Reducing or eliminating alcohol and avoiding tobacco can have a positive impact on your health. These substances can interfere with treatment and recovery, so consider making a commitment to your well-being by cutting back or quitting altogether. Your body will thank you later, trust me. 7. Stay informed and engaged. Knowledge is empowering. Stay informed about your condition and treatment options. Understanding your diagnosis can help you feel more in control and prepared. Don't hesitate to ask questions during your appointments and discuss any concerns with your healthcare team. They are there to support you in every step of the way. Number 8. Listen to your body. Your body knows what it needs. Pay attention to how you feel and adjust your activities accordingly. If you are tired, allow yourself to rest. If you are hungry, nourish yourself with healthy food. Being in tune with your body can help you make choices that support your health and well-being. 9. Celebrate small victories. Every step forward is worth celebrating. Whether it's completing a treatment cycle, sticking to your exercise routine, or simply having a good day, take a moment to acknowledge your achievements. Celebrating small victories can boost your mood and remind you of your strengths. You are strong. Don't forget it. 10. Seek professional guidance. Consider working with a registered dietitian or nutritionist who specialize in cancer care. They can provide personalized advice on dietary changes that support your treatment and overall health. Additionally, a therapist or counselor can help you navigate the emotional challenges of your journey. By embracing these lifestyle changes, you can take proactive steps toward enhancing your health and well-being during your treatment journey. Remember, you are not alone, and every positive change you make is a step toward empowerment and healing. Your journey may be challenging, but the right support and lifestyle, you can navigate it with strength and resilience. Thank you so much for watching. Subscribe to see our next video. In it, we will discuss the latest discoveries in gut health and how to have a great life by changing what you eat. Until then, take care of yourselves and remember, your health is your greatest wealth. See you next time. Thank you, my